Saint Lucia should brace for the possibility of more COVID-19 cases as the economy and borders gradually reopen. There are concerns that the COVID-19 numbers could go up once travel resumes in the first week of June. Saint Lucia's incidence rate stands at 10 per 100,000, one of the lowest in the Eastern Caribbean. National epidemiologist Dr. Michel Francois warns that due to the problem of illegal entry, one cannot conclusively state that the island is COVID-19 free. Officials are preparing for possible infections as the island moves to stage 4 of the incremental restart of the economy.
We have individuals coming in through all routes. We have persons coming in, as Marine Police keeps pointing out, through the back door. We have no idea how many persons have come in, and we have not detected. We have no idea how many persons come in, but those that we do get, these individuals are placed in quarantine and are monitored. As I said earlier, also with the opening of the borders, we do expect cases. When you look around the world in the larger countries, they are still going through some major outbreaks. And so by opening our borders, there is always the possibility of a case arriving at our shores.
Authorities have changed testing and surveillance strategies and plan to enroll resorts to help detect cases and keep the numbers down. So what are the signs that could result in going back to a previous phase? Dr. Francois explained that it's just not an increase in cases, but an epidemiological link.
If we detect, say, 10 cases, and these 10 cases are linked to a household, that is totally different as opposed to having 10 cases scattered around St. Lucia, where you have to now go and find where that source was. So if there is no epidemiological link and we have that number of cases, then by all means that is a warning sign, which means that we have had some level of spread as opposed to it being limited to a particular household. So we continue to look at hospitalizations, the number of severe acute respiratory illnesses that come into our country.
The business sector received the green light to resume operations granted they follow health and safety guidelines. The Public Health Department encourages establishments to abide by the protocols.
There may be some hindrances and things may not flow as we are used to. However, think of it as doing it for your family, for your mother, for your sister, for your brother, who, if they do get COVID-19, may not be able, because of their immune status, may not be able to withstand. So it's a change. COVID is here to stay. It is really a change in thinking. It is really a change in behavior right now. It is not business as usual, and we're asking you to please adhere to these guidelines, to these protocols, in order to avoid as much as possible further transmission of COVID-19.
Despite the challenges, Saint Lucia and the Caribbean have one of the lowest case rates in the world. Dr. Francois credits early implementation of quarantine measures for the success of the region. She encourages Saint Lucians to stay the course.
During the periods that we had our partial and total shutdown, those were very much warranted when we were able to actually go out in the field and do the necessary. And I spoke to contact tracing earlier. Persons were at home and we were able to find persons, pick them up very early and place them in quarantine, thereby breaking that transmission cycle. So the mask, the hand hygiene, these measures play a key role in prevention of COVID-19 and breaking that transmission cycle. And it is something that I would ask the public to, it may seem simple to you, hand sanitizer, hand washing, the mask, but every little one plays such an important role in restricting or reducing transmission of COVID-19 in St. Lucia.
Some 900 people have been quarantined and placed in isolation, 250 of whom are currently in quarantine, and some 68 to 78 still in isolation. Given the possibility of a more deadly second and third wave of the pandemic, should countries ease restrictions too soon, the WHO has warned that COVID-19 may never go away. Some argue that the virus might follow the path of the Spanish flu in 1918, which continued in waves till 1920. Gino Filippi, HDS News Force.